This event is born out of the creativity and the promise of making public data available for public good.
What if we could answer questions like what environmental and social factors don't we know about that correlate to better outcomes? Or what children really are at risk?
You put publishable data, I think, in the hands of Californians with our unparalleled history of innovation. I think the return on this investment will be incredible.
We're here at the California Open Data Fest trying to help facilitate California's approach for open data. And so we've got thought leaders from around the country that are here sharing some of the industry's best practices and tackling head-on some of the fears and challenges of effectively implementing open data with a particular focus around health and human services.
I think the most important benefit of open data is that it can catalyze innovation by entrepreneurs, by journalists, by researchers, local policymakers, and the list goes on. If they have better access to data, that is those outside of government, then you're in a much more powerful position to be able to do much more useful things with those data.
It's something that has unmeasurable amount of benefits to it as far as being able to encourage economic development, as far as allowing better analysis of health disparities, better analysis of data quality and how we're capturing it.
90% of all research is collecting, cleaning data, and so if that 90% were gone, we could get to some answers a lot more quickly. And I think that that would facilitate the clinician's business and also make resources available to their patients.
Government has an amazing amount of data piled up over the years that just comes as a part of providing the services. As you get people with the capability and the time and the resources to start to put those together in ways they haven't been done before, you start to see trends that nobody knew or even thought about looking for.
Just as an example, I talked a little while ago about a company in New York that's using open health data to essentially disrupt the post-acute care facility industry. Who would have thought that that was something that could be possible, right? But people took this personal experience and turned it into something that's actually helping thousands of people out there.
When we get to a place where we're actually sharing data with each other, and that's within the county, across county departments and schools and the cities, then I think we can make the most impact in the community. Healthier community, safer community, more self-sufficient, livable, all of those great things that our community deserves.
We need to do more in California. We need to do more at the state level to leverage this type of brilliant experience, expertise, and results into something that can transform all of our different experiences into something that helps us accomplish those common goals for health and human services.
I believe we still have numerous untapped human services data sets that can be identified and described and cataloged on healthdata.gov. And I believe that we can also be a key partner in communicating the role of human services data and disseminating it broadly.
And I want to tell you about the immense amount of energy that we're seeing all across the country and now all across the world that is basically being driven by this raw material of open data.
It's here, it's available, and it's a pretty exciting opportunity to think about how you can build these new models of care and data to enable them.
And that's part of the exciting part about open data. It really complements in many ways providing a three-dimensional or holistic perspective of a client or a person in their community.
Data's everywhere, but we need to put it to work. If you think about it as the encoded history of everything that we know, then it should be the single most important factor in informing what we do next, in changing policies, in creating better interventions, in essentially shaping the future and every aspect of that future based upon all of that information. That's the Holy Grail.